Good afternoon, Facebook. Good afternoon. I am Tyra Watson, and I am coming to you all today from the Grief Corner. And we are located at the 7901 South Kaminsky, Chicago, one block west of 79th and Pulaski. Again, this is Tyra Watson coming in from the Southwest Funeral Home, located at 7901 South Pulaski. 7901 South Kaminsky, one block west of Pulaski. And this is the Southwest Grief Corner. Welcome back, welcome back, welcome back. And it is a pleasure to have those who are joining at some point when you play this video back. Thank you for even taking the time to play the video back. Thank you for stopping your scrolling to join me. I am here yet again for the Grief Corner to offer my support and talk to you guys. Today we're going to do something just a little bit different. When I talk to you guys, I always do express, and I've often expressed that, of course, the Grief Corner is for the living. Because those that we've lost, they are gone. So I'm not here to talk to them. I'm here to talk to you all. I'm here to care for you guys. And I'm here because I care for you all. And so today we're going to be talking about proactive prevention in grief. We are losing people every day. There are a lot of people who find that they are suffering from the loss of a loved one that actually could have been prevented. And so that's what I want to talk to you about today, because we are talking about those who are actually living, and we're talking to those who are living. Then I wanted to kind of put a nudge on your heart, put something on your mind, and hopefully call you to a response, which means that we are currently right now in open enrollment season for a lot of companies, a lot of businesses. This is that time of the year where they are doing open enrollment. A lot of companies, and it continues to grow, do wellness and have wellness programs in place. I've been in death care. This is my first full year in death care, but I've been in healthcare for the last 23 years. And healthcare moved to a preventative model of care a few years back, at least 10 years back, but more people are familiar now with wellness and wellness exams, having to do wellness checks now, because companies require it. And the reason why they require it or are giving discounts on insurance and offering premium plans to those who participate in their wellness program is because an ounce of prevention is worth more than a pound of cure, which means if I can catch a thing before it gets too far gone, if I can do something about the condition, the problem, the disease, or the disorder, the beginning stages of a thing, then it costs less money to actually be able to treat it, and or it costs less money to be able to manage it. And unfortunately, we have every day people who die from things that if they had only just checked with their doctor about a particular thing or maintain their wellness, then the issue that actually cost them their life could have been treated. It could have been avoided. And so that's what I wanted to talk to you guys about, proactive prevention in grief. So some of you all come to the Grief Corner today, maybe expecting the encouragement from the side of helping you where you are feeling the loss of your loved one. But today, the way that that's going to spin is that I want you to think about your own health. I want you to, especially if you lost a family member because of an embolism, if you lost a family member because of infection that eventually either caused them to become septic or eventually maybe caused them to go into shock, or a combination of, or may have caused them to go down a very slow decline of metastasizing infections throughout the body. but it could have been avoided. And sometimes these things, it can start with something as simple as a toothache. A lot of us have had to go to the dentist at some point because we lost the feeling or we were having some type of tooth pain. And even right now today, talking to you guys, there are a few 100,000 people walking around with some type of hole in their tooth or dental issue. And what's happening, because I know we're scared to go to the dentist, no one wants to go and have the needle poked in your mouth. You know, you think about it and it's just all of it's all bad. But by going to the dentist and going ahead and doing what has to be done to handle the issue of the hole in the tooth, which is causing you mild pain, and you're probably using a little bit of Orajel and maybe taking some Aleve or maybe ibuprofen. Maybe if you have prescriptions for something stronger like Vicodin or something like that, then it could be that you already are just pacifying it and you're like, hey, it'll be okay, it'll pass. But it's like a parking ticket. It does not pass and they do not give you breaks. And it's the same thing for even something as simple as a hole in the tooth, that because their tooth is open, everything that's going into it or everything that goes in your mouth can go into that tooth. And subsequently, you guys find out when you go to the dentist that you have an infection because all of it's been there. But don't you know that that infection sitting in your gum line like that, so close to your brain stem, is enough to kill you in an instant. It's enough to debilitate you in an instant. It's easy for it to get into the bloodstream, and something so simple as what started as a toothache can become something that has infection spread through your body and cost you your life. We know about the preventative screenings for going. We know about cancer. We do mammograms for cancer. We do OB-GYN visits, looking for ovarian cancer, looking for any type of abnormalities in those tissues, uterine cancer. All of this is huge. Why do we do that? The guys, they ask you to do your prostate checks. Why? Because of prostate cancer. They do the colonoscopy so that you can look for colorectal issues. People die of colon cancer. Common, but these are all things sometimes that can be avoided. And because people die because of these things, then I wanted to talk to you guys. This is open enrollment season. This is wellness. If you lost someone because of something that actually could have been dealt with, if they would have went ahead and went to the doctor, if they went ahead and they would have taken care of it, but they were scared or they didn't want to know. They knew something was going on, but they did not want to go to the doctor. Of course, you miss them and you love them. And actually, if you knew that this was the situation with them, it might even cause you to be angry with them once they pass away, because you're thinking to yourself, I, told, whomever that they needed to go to the doctor about that. I begged and I asked and I pleaded with her or pleaded with him to go to the doctor to get it checked out, and they just would not go. And now I'm so mad about that, or whatever, because you actually are the one that is left to deal with the hurt and the pain and to pick up the pieces. And so I urge you then today, in order to make sure that the same grief is not caused to your family members, if something should happen to you because of a failure to take care of yourself, because of a failure to go ahead and acknowledge something that you know is not right, then I want you guys today to take introspect. If you haven't been to the doctor in a long time, I know they normally like to say men don't like to go to the doctor, and that's true. A lot of men don't like to go to the doctor. So for my men, if it's been a while since you've had your checkup, if it's been a while since you've seen a doctor about anything except for something that may have been emergent, please, definitely, for sure, go ahead and make an appointment with your doctor. Do your wellness checks. If you are of age 35 and older, you should be doing at least an annual physical every year. If you know that you have genetic diseases, you should definitely be keeping up with the markers for that. You know, find out where you are relative to this thing, and then keep up with it. Keep an eye on it. You know that diabetes runs rampant in your family. If you lost your grandmother, and then you lost your mother, and you lost a few aunts and some of your uncles because of manifestations of diabetes, then make sure that you keep up with your blood sugar level. Make sure that if at any moment that blood sugar starts to spike, that you do exactly what your doctors are asking you to do. If you feel like, because there's nothing wrong with getting a second opinion. If you feel like you need to get a second opinion and those doctors are not giving you information that maybe is syncing well with you, it is okay to go get a second and even a third opinion. But whatever you do, please make sure that at this junction and at this time in life that you take a consideration as to things that may be going on with you, whether it's something as little that can become big as a hole in your tooth, or whether it's something as simple as a bump that's on your leg that's not going anywhere, and it seems maybe to be, whether it's discolored or hard or soft, you know that when you compare it to the other leg, that something about it is not right. It can be very scary to go and find out, what it may be. But it's even scarier if you do eventually wind up in the emergency room and find out that had they been treated earlier, had it been brought to the medical professionals' attention earlier, that they actually could have saved you. There are women that have had mastectomies or breast removal because of breast cancer. This is Breast Cancer Awareness Month, and some of our ladies were able to become survivors of breast cancer because they found out early enough that even though the treatment was aggressive and they had to lose a breast or they lost both breasts, they still have their life. They're still able to see their children grow. They're still able to see their grandchildren. They're still able to have productive lives and move past it. And then they know that they just have to keep an eye on things to make sure that if they come out of remission, it can be dealt with. But then there are other women who have lost their lives to breast cancer because they didn't catch it in time or because they were scared. I can go across the board with different conditions and diseases that will kill us or that can kill us. But the best thing, again, is to remember an ounce of prevention is worth more than a pound of cure. So if you have not been to the doctor to do your wellness check, if it's been a while since you've been to the doctor for anything, again, I urge you now to go ahead, face your fears for whatever you think might be wrong. If you know there's something going on with you, to go ahead and face your fears for being in a doctor's office or for doing different testing, so that you can make sure that you find out exactly where you are. And if in fact the doctors have asked you or are recommending for you to do something, please go ahead and do it. And again, if you don't feel comfortable, then do a second and a third opinion. But I'm saying this to you for you to be able to make sure that you take care of yourself, that you do not allow something that could be controlled to cost you your life, and of course cause grief to your families. So this is not just about grief. The Grief Corner for supporting those who have lost their family members and loved ones. But this Grief Corner is also to help those in the same manner to do what they can for their own self, to have the healthiest and most productive life possible. And so again, this is proactive prevention in grief. So help save your families from your loss or an untimely demise by making sure that you're taking care of yourself. Make sure that you find out about those things that are, again, giving you question or that are not normal. Okay, so let's make sure that we take care of ourselves. Again, it is open enrollment season for a lot of companies and places across the board, across this world, and so we definitely want to make sure that we jump in, assess our own health, find out where we are, and do not be scared to follow the doctor's recommendations, as it could save your life. So that's all I wanted to lay on your hearts for today. I did say last week that next time I returned, I was going to return with a special guest. I do have someone that's going to be joining me. That'll be the week of November 9th. I will not be here next week. And so look forward. She's coming on to talk to the men. All people grieve. Sometimes men are left to feel strong, and they're left to have to carry the weight, if you will, or feel like they carry the weight because they are men. But men hurt too. And with that being considered, sometimes their issues are not dealt with. Their feelings are not dealt with. So we're going to have Miss Linda Clark to join us from Virginia. She's a mental health counselor there, and she's going to come to talk and join us to talk to the guys. Of course, the ladies, we want you to join as well, because we all have men in our life, fathers, grandfathers, uncles, cousins, brothers, friends. So we want to make sure that if they don't hear it, that we get the information to disseminate and share with them, especially if we know that they're grieving or have been grieving the loss of someone that they love. I do love you guys. Have a wonderful weekend. It is Halloween weekend. Please be safe. Whatever you do, of course, make sure you wear your mask. Please feel free to visit our website, www.southwestfunerallandcremation.com. Again, that is www.southwestfunerallandcremation.com. And there's information for grief resources there. If you even widowers and such, we have grief groups and information that's just helpful. So please go on there and join. Talking about being proactive in grief. I've talked to you guys about financial grief and double grief for families. We of course have, myself included, insurance agents that can help you with your life insurance needs. Do not cause your families to be grieved, double grieved, because of the loss of your life, and then no money to help take care of services. So even down to insurance, you can contact us, set up an appointment with me or one of the agents, whatever's your pleasure, and we can also discuss your insurance needs, because just like you need to assess your physical health, you need to also assess your financial risk and financial health in the way of making sure that you have insurance protection for your family. And of course, there's other things that we can do with that insurance too. So we can talk about that. But let's make sure that that's taken care of. So we do have that information. You can contact us that way as well. I do love you guys. Again, hello to everyone that's on here. Thank you so much for your support, and thank you for always allowing me to bend your ear and being and just be an encourager to you and a hope to you. It's definitely my heart's joy to be able to do that. I will look forward to seeing you guys the week of the 9th. If you guys have any questions, you can always feel free to call our office here. It is 773-424-3151. Again, our office number is 773-424-3151, and our website is www.southwestfunerallandcremation.com. Again, that's www.southwestfuneralcremation.com. Again, take care of yourself. Be proactive about your prevention in grief to your family. Okay? God bless you guys. Bye.